So, what barriers do you see in someone getting the help that they need?
Right now, I would say it is the lack of providers available to provide the increase of need and services. I would say is one of the biggest things that I've been noticing. Secondly, I would say is finances. How can they afford to? Because even if we have insurance coverage, we have copays. And for a lot of us, we are on a very limited income, or our money is spread in all different areas of our lives, and considering paying that $25 copay on a weekly basis is just not in our budget. And so a lot of people don't seek services because it's not affordable. What I see is, finances and availability of actual providers to give the services that people are needing now, since we've had such an increase.
I absolutely agree with that, because even if it is just $25 a week, 25 may not sound like a lot, but 25 times 4, that's $100 a month. That's somebody's light bill. That's a big barrier for treatment. But not only that, but just coverage. Sometimes insurance coverages aren't very welcoming to mental health or substance abuse treatment. They might have less of a payout on mental health care, and they might not pay anything for substance abuse treatment. And that's one of the things we've seen from COVID too, is the increased use of substances. People that may have casually drank before might have developed a actual substance abuse issue, or with drugs or alcohol, or things like that. But what they find is their insurance may not cover that treatment. There used to be this, the movie called 28 Days, where Sandra Bullock went to rehab for 28 days. And everybody thinks that rehab is 28 days. It's not, because the insurance doesn't cover it for 28 days anymore. You have to have certain criteria to even go, and then you have ongoing reviews to see how long you can stay. And then people think about Medicaid. Well, Medicaid will pay. No, Medicaid doesn't cover any substance abuse treatments. So there is a lot lacking in coverage, in insurance and Medicaid coverages for mental health care and substance abuse issues.
If I may add in here, one thing that I'm really proud of our community here in Northeast Arkansas is there is state funding that can help with that. But what happens is there are so many people who are needing those funds that it runs out very quickly. So, there by the end of the year, sometimes 6-7 months in, there's no more funding for the other 4 to 5 months. And so there are things that are in place to help reduce those barriers, but it's just not sufficient for the need. It wasn't before the pandemic, and it's especially not sufficient now.
I'll just throw in a plug for St. Bernard's, because we are a charity-based organization. We're a nonprofit, and we do have charitable assistance. So if you or someone you love could benefit from some treatment for mental health needs, we could definitely help with that. We could assist you with filling out financial assistance paperwork and see what we can do to help you.